COVID-19's toll on nursing homes in the U.S. became clear early in the pandemic. In response, researchers from different universities in Missouri are investigating. In one study, analysis of federal data by researchers at St. Louis University shows that 23% of all COVID-19 deaths in Missouri have occurred in nursing homes and long-term care facilities. Early in the pandemic, in the first wave, that death toll was nearly 50% of all COVID-19 deaths in Missouri.
An inordinate number of deaths in the nursing homes during that first wave. St. Louis was one of the first cities that was impacted by COVID in the state. And there were nursing homes that had the entire nursing home infected, and then there were those that were relatively unscathed.
Lori Popejoy is the Associate Dean for Innovation and Partnerships at the University of Missouri Sinclair School of Nursing. She teamed up with Associate Professor Amy Vogelsmeyer to study how Missouri nursing homes responded to the pandemic. They received a nearly $2 million grant to assess more than 500 nursing homes.
So this is a 4-year study that was funded by the Agency for Healthcare Research and Quality. And we will be looking at nursing homes across the state of Missouri so we could really learn from what they did and what worked and even potentially what didn't work in terms of trying to keep residents safe during that time. There may be a nursing home that was residing in a county that had very high COVID rates. And you think about people in the community are in and out of the facility often. They live in that community and work in that facility. So the risk was high for transmission. And so we want to be able to see what was it that the facilities were able to do to sort of keep COVID at bay as best they could for as long as they could, despite the fact that these county rates were high. And sort of the converse of that is those counties that maybe had low rates where the risk was more limited or potentially less, and those facilities that maybe had high rates and what was happening there and how did that outbreak really happen. So it's looking at this diverse group of facilities across the state with different experiences in regard to the pandemic.
To accomplish study goals, they're evaluating statewide data from the start of the pandemic continuing through 2025. And they will extensively study 24 nursing homes.
Looking at rural, urban, suburban, so you get this variation geographically.
Beyond COVID-19 illnesses and deaths, the research team is investigating adverse effects on residents from lockdowns, visitor restrictions, social distancing, and more.
Lockdown, no outsiders were allowed in. How were they able to maintain contact, if at all? What effect it had on them and their family member to be in that type of isolation for so long? They're sequestered to their room, so they can't go to a common dining room. They can't go to activities, and so they're sitting in isolation. So that adds an additional staff workload. Because you think about a dining room full of residents, staff can do really quick surveillance of, are they eating well? Are they not eating well? If you're not doing that, then staff are really required to go room to room to room to do that, to make sure that they're eating, to make sure that they're moving.
You're changing the entire model of care from congregate living to isolation in rooms. And it takes more people to take care of those kinds of situations. So you have the same or fewer number of staff because staff were also ill and unable to come to work.
In the selected 24 nursing homes, leadership, staff, residents, and family members will have a chance to share their stories as the study includes a process of interviews.
We'll be recruiting residents and families to provide input to us about what those experiences were. And we're looking across a variety of staff. Our hope is that there will be people in the facility working who were part of the pandemic when it started, and we're finding that that is the case, and certainly for some nursing homes.
We're hoping to be able to pick up some of the physical and emotional changes that occurred in residents. When we talk to family members, I'm sure we'll hear of the discomfort and the distress that was associated with not being able to see their family members. I think it was almost a year from the time the nursing home locked down to when they opened up. So there was a lot of emotional pain, fear, and changes in quality of life for both residents and families.
The research team noticed early in the study inconsistencies, how COVID-19 policies varied from one location in the state to the next.
There was inconsistencies at the local county level and the local health department level. So, and that's sort of the reportings that we're getting now just from our statewide stakeholders, that some counties were very involved in partnering with the nursing homes. Other health departments were less involved with the nursing homes. And so they were sort of left sort of to their own devices based on what they were being told from the state.
Through the study, the researchers hope to identify strategies some nursing homes use to overcome challenges, and they hope to offer recommendations to nursing homes across the country for improving quality of care and patient health outcomes.
Even though this is a study taking place in one state, the experience of Missouri is representative of the United States as a whole. We are still in the midst of an unfolding pandemic, and a lot of unknowns continue to evolve. It's surprising. I know it probably shouldn't be surprising, but I think the lessons we learn will be even more robust because it's continuing to evolve.